Good afternoon. This is Lori Latham from the Kent County Administrator's Office, and we are going to go ahead and get started. Wayman, if you want to open us up.
Good afternoon, everyone, and welcome to this presentation. I hope that you will learn a lot today. We have Adam London here from the Health Department along with his team, and we are very, very pleased with what they are going to share with you today about the COVID-19 vaccine and what we're going to do to make that available for the community. So just wanted to give a shout out to everyone. Please continue to do all that you can to remain safe and continue to do the fine job that you all are doing to represent Kent County. I'm so happy with the way things are going these days, and very pleased that we're able to have this town hall. So thanks, team, for making this available, and we're looking forward to hearing from the health department, and I will turn it over to Adam London.
Thank you, Wayman, and good morning, everyone. And I'm going to open up our slideshow here. Hope everyone is enjoying the season and hope everyone has a happy holiday. So what we're going to do is I'm going to, first of all, give you a little bit of an introduction as to where we stand right now with our numbers related to COVID-19 in Kent County. And then I have some of my superstar team from the health department that are joining me this afternoon to talk about the vaccine. I've got Dr. Carla Black, who is a virologist by training. She's our emergency planning coordinator and is working as our planning chief during this pandemic response. We have Mary Wazinski, who is an immunization supervisor here at the health department and is doing a great job in planning the clinics and making sure that we have safe storage and handling and proper and efficient processes in place. Christopher Bendecki, who is our operations chief for testing and for vaccination, and he's our division director in the clinic here at the health department. And Dr. Nurali Bora, who is the medical director here at the Kent County Health Department, who can talk more about the phased approach that's going to happen, along with answer many of the questions that you all have, and so many of us have about the safety of these vaccine products. So let's briefly take a peek at where things stand right now. This first graphic shows what we call the epidemic curve. That dark blue line is the rolling average of the number of new cases day over day that we've seen during this year. The virus first arrived here and we first started seeing cases in the springtime. We had that, we call it at the time a first wave back in early May. Doesn't look like much of a wave now in retrospect, but after that we saw our numbers level out for most of the summer. We were seeing an average of 30 to 50 new cases per day. Then as we approached the fall, October, November, we saw this large surge in cases here in Kent County and through so much of the rest of the nation as well. Right now, we've seen a total of over 39,000 cases this year. At this time, our daily average is 240 cases per day, which is still far too high, but it's much better than where we were at a month ago. A month ago, we were close to 700 new cases per day, which was overwhelming our hospitals, overwhelming our case investigators, our contact tracers, and was really a number that was unsustainable and leading to a very dangerous point for our community. We have seen these numbers come down, and as a result, we've seen hospitalizations come down, which is a very important measure. At one time, we were close to 400 people hospitalized. I think at this time, we're actually getting closer to 200 people. And as these cases continue to fall, hopefully our hospitals will see less and less burden from COVID-19. Another measure that we carefully watch is what we call positivity rate. That's the percentage of the tests that are conducted each day for COVID-19 that come back positive. The ideal is to have a positivity rate less than 3%. And that's where we were at for most of the summer. About a month ago, we hit our high point with a positivity rate in the high teens. and that's far too high. That's what we call a high level of community-wide transmission. Now, and actually yesterday for the first time in quite a while, our positivity rate has dipped back below 10% again at 9.9%. So we hope to see the percentage of those tests being done every day continue to fall, the number that are positive. And the most sober measure of all is the measure of death here in the county. Our current average number of deaths per day is 4.71. That is down a little bit from where we were at a few weeks ago. Sadly, we've lost 468 people to date from COVID-19. And here you can see what we look at as our death wave, which, you know, we had for most of the year, one death every 3 or 4 days, which was tragic enough. Lately, we've been having 4 to 5 deaths every day, which is far too high. And we want to see that number continue to fall. It seems like it is coming down now again. The death count is what we call a lagging measure. It always follows cases by 3 to 4 weeks. So we're hoping now, as our cases have declined for several weeks in a row, that maybe we're starting to see our death rate fall now as well. And our case mortality, which is the percentage of people who've been diagnosed with COVID-19 who don't survive, that number is at 1.2% right now, which is actually much lower than the state of Michigan overall or other communities our size. So overall, we're doing pretty good as a community. Could be a lot worse, but certainly very severe. And much of the thanks for that lower case mortality, I think, goes to the community who's doing their part in the large part by wearing facial coverings, social distancing, doing the things that make it difficult for the virus to spread, the great work of our hospitals, the great work of our testing to identify cases early on, to do that contact tracing, the isolation, the quarantine, to make it difficult for the virus to spread. But there's still a lot of work to do. But that work comes with new hope and a new tool now that we have in approved vaccines. And at this time, I'll turn it over to Dr. Carla Black, and she can talk about these vaccines in greater detail. Carla?
Thank you, Adam. That was a really great overview of what we're at in our community right now. Next slide, please. Thank you. So I'm going to talk a little bit about some of the larger vaccine planning efforts that are going to be going on across our community, starting with the 8 things that the CDC wants you to know about vaccine planning. The first of which is absolutely safety. Safety is always the #1 priority when it comes to vaccines. And while overall this vaccine seems like it got to the market a lot faster than other vaccines, which is accurate, they still went through all the different phases that are needed to test out the safety and efficacy of these vaccines. You probably heard about the phase 1 trials through the phase 3 trials. So they still went through all of that, but the way the vaccine is made is a little bit different than other vaccines that we've had in the past, in which the virus, it's not a full virus, and Mary's going to be talking a little bit more about this later, but it's actually really an interesting way to look at it in terms of how it's made in a lab, and it can be made actually faster. Number 2, many vaccines are being developed. As we've heard already that there are 2 out that have been approved by FDA for emergency use authorization, but there are probably going to be more coming. This is actually a really great time in terms of science. The entire world is coming together to work on one focused goal of getting a vaccine together. And of course, we didn't want to put all the eggs in one basket. And so there might be some ready before others, but there are still more coming down the pike. And you heard me mention the emergency use authorization. So this is a process that the FDA can push vaccines and medications forward because of a pandemic. And so basically we have to balance the safety and the ethics of making sure that we can get vaccines and other biologics out to people as quickly as possible to save lives. And so that the emergency use authorization is incredibly important to get those out as quickly as possible. Number 4, there is certainly going to be a limited supply of vaccines early. And we are all certainly seeing that vaccine is currently out, but we know that there will be a lot more coming in the weeks and months to follow. But we have to be very cognizant of who those vaccines are going to initially because of that limited supply. And Mary or Dr. Bohr will be talking a little bit more about all the different phases. So I'm not going to jump too far into that. Also, right now, the COVID-19 vaccine is not recommended for children under the age of 16. So right now, the vaccine is approved for those that are 16 and above. And we'll talk a little bit more about that in the upcoming slides. But one of the really big important things that we want to make sure that this is out there, that we don't want cost to be an obstacle in getting vaccinated against COVID-19. If you come through our clinic, when it's your turn, we will probably be asking you for insurance information. However, you will not be billed. There should be no cost to anyone when it comes to getting this vaccine while this is being rolled out. And then finally, number 8, COVID-19 planning information is being updated continuously. And so we want to make sure that people understand that this is a continuously very fast moving pandemic with a lot of new information. Like I said before, what's really interesting about all of this is that we have so much science going on right now, and the world is coming together to make sure that we have the best new information possible. So we continue to get more and more information. We want to make sure that that is updated as it becomes available. So those are the 8 main things to know about the vaccine planning. And here at Kent County Health Department, and also along with the Michigan Department of Health and Human Services, there are 4 kind of overarching goals in our planning. Number 1 being, we want to ensure that we are safely and efficiently distributing the vaccine when it's available. So we currently have some, and we want to make sure that this is being tracked and monitored appropriately. So our clinics division, along with our other people in our department that have been working on this planning for months, actually years and years, because we've had an emergency preparedness program for so many years now that we've always had a mass vaccination plan that has been utilized during H1N1, but now we're just making those modifications because of the nuances of COVID-19. But we are tracking, we are monitoring our vaccine to ensure that we know where every dose is going, and also the follow-up with the vaccine as well. But also we want to ensure transparency and public trust. We are working with an ethicist at the health department to help us make ethical decisions in looking how the vaccine will be equitably accessible across the vaccine when it becomes more widely available. But we want to ensure that our decision making is sound, and we want to make sure that we can instill public trust in our decision making of how this will roll out. And then finally, proper engagement of the stakeholders and community partners. We really rely so heavily on our preparedness partners, all of our stakeholders and community, because without them, we don't know everything that's going on in the community. We want to make sure that we are taking every piece of information we can into account when we're doing our planning. Next slide, please. Thank you. So that really leads into a lot of community engagement. And this is just a very, very short list of some of the people we are currently working with. In our incident command structure that we are utilizing for our response at the health department, we have a race, equity, and inclusion group that is working with a lot of groups across the community to ensure that we are taking into account race, equity, and inclusion when we are doing our planning. We have a church leaders group, hospital leadership group, long-term cares, community stakeholders, community connectors that have been really fantastic, that have been working with us at the health department, that make connections between us at the health department and those out in the community to help instill trust and answer questions and get perspectives that from those that are out in the community. It's been absolutely fantastic to hear from them. The Kent Intermediate School District, and we just have so many meetings with businesses. I mean, I would say a lot of our work is doing a lot of outreach now, trying to make sure that we are understanding any questions or concerns from the public and how can we do education to help allay fears. Next slide. And one of the other big collaboratives that we're working is what we're calling the West Michigan Vaccine Collaborative, that includes us at the Kent County Health Department, along with a number of other health departments in West Michigan, including Ottawa County District Health Department number 10, Mid-Michigan District Health Department, Berrien County Health Department, and Barry-Eaton Health Department, along with others. But we really try to make it so that the health departments are interacting heavily with the pharmacies and the healthcare systems, and other response partners to really make sure that we're all on the same page, because we have such diverse populations in our counties across entire West Michigan, that we need to try to be collaborative and consistent where we can be, and try to take into account the differences in our communities, and make sure that we're not really kind of going off in a direction that doesn't make sense for everyone to follow. So we're really just trying to make sure for consistency that we are working together, and especially in messaging. And so one of the really great things that has come out of this, and it was spearheaded by Lori Latham and Steve Kelso and the communications group at the Kent County Health Department and Kent County as a whole, is the website you see above, Vaccinate West Michigan, vaccinatewestmi.com. And this is actually, we're trying to make this a one-stop shop for everything about COVID-19 vaccine. And this is serving all of these groups that you see below, along with everyone else that I've mentioned. And so we're really trying to be collaborative in our messaging as well. Next slide. So with that, that's some of our really high level planning that we're working on right now. Again, lots and lots of community participation and just working with so many partners right now. And I just want to thank everyone for their continued vigilance, and have a happy holidays. With that, I'm going to turn it over to Mary Wazinski, our immunizations coordinator, to talk about the specifics of the vaccine.
Good afternoon. My name is Mary. I'm just going to give you a little information about the 2 vaccines that have recently been approved by the FDA. And the first one that came out was the Pfizer vaccine. Next slide, please. So this is a little bit more than you want to know, but many people say, why can't you bring it all out to the community? Why are you only vaccinating at the health department? But this vaccine has really strict storage requirements. It requires an ultra cold deep freezer. So if you look on the right-hand side of the screen, it's frozen anywhere from -70 degrees Celsius to 10 degrees Celsius. There's strict instructions when you get the package of how to unpack it. When we do a clinic, we need to figure out how many doses to take out of that deep freezer, because you can only enter it a couple times a day. And when you pull out your doses, you can only have them out for 3 minutes. This vaccine's minimum order, it says 1,000 on the screen, is really 975 doses. And we kind of joke, but it's about the size of a pizza box. So each small vial holds about 5 doses per vaccine, and it takes up much less space in our freezer than you would think. There's a tracking device in it when it comes from the manufacturer, and you need to punch a button when you receive it, so they know exactly when it got to you and what the temperature was. We do have to use what we call a diluent, which is a liquid, to reconstitute the vaccine. And then there's strict requirements for that as well. You can put it in the refrigerator for 2 to 3 hours. You can put it at room temp for 30 minutes. And then once you do mix it up gently, you have to use it within 6 hours. So once again, when we schedule our clinics, we need to make sure we have the exact number of people for the exact number of doses. So it does become a little bit of a juggling act. This This vaccine is 0.3 cc's, which isn't much. Our normal vaccines are anywhere from 0.5 cc's to 1 cc. It is a 2-dose series. There's 21 days between doses. And these are the things we're working with, why in the beginning we're going to do closed pods to get used to using the vaccine and to make sure that we keep it viable, because we need to make it work. Next slide. The second vaccine that was just approved last weekend is Moderna vaccine. So let's talk a little bit about that. It also is a frozen vaccine, but it can be stored in a regular vaccine approved freezer or a pharmaceutical grade, not like the freezers you would have in your home for storing food. And unlike the Pfizer vaccine, this one does not need to have a diluent or be mixed up. It comes in a 10-dose multi-dose vial, and you can order 100 doses at a time, which for many of our smaller sites will be a great option. They don't want 975 doses, but they could certainly use 100. So with this, we need to make sure that it's kept at a really narrow range, minus 25 degrees Celsius to minus 15 degrees Celsius. In other words, we don't want this one to get too frozen. This side says if you stick it in the refrigerator, you have to use it within 7 days. They've just told us that we can increase that to 30 days. So this would be a great option to transport to an office that could schedule some clinics and use the vaccine that we give them within a month. Like the Pfizer vaccine, this one has to be thawed for a couple of hours, or unlike Pfizer, which you have to stand at room temperature for 30 minutes, this one is 15 minutes. And then it gives you some other parameters where you have to have no more than 12 hours. And once you enter it, you have to use it in 6 hours. So you can see, as Carla said, how this storage and handling is very specific. I have 2 great nurses that are used to dealing with this with our vaccine for children providers in Kent County. So they're teaching our other nurses all the little tricks of the trade here. And I know this is probably more than you wanted to know, but this is again part of assuring that from shipment to putting the vaccine in a person's arm, that there are no breaks in the cold chain. And we make sure that when we do give you that vaccine in the arm, that it was stored and handled properly, and every step was taken to make sure that you get a viable vaccine. Thank you, and you can put any questions in the chat. And I'll turn it over to Dr. Nirali Bora.
Thank you, Mary. Good afternoon, everyone. So looking at this slide, this goes over the priority groups for vaccine distribution. So the priority groups are determined mostly at the federal and at the state level. And you can see here in priority 1, so this is really the goal of priority 1 is to make sure that our critical healthcare infrastructure is open and functioning, and it focuses on the people who really are needed in that sector. So you can see in priority 1 that we have people like EMS, our medical first responders, the people who work on general medical floors in the hospital, those who work in the emergency department, ICUs, and people who are doing vaccinating. In priority 2, the goal for this priority is to really prevent outbreaks and to protect residents who live in long-term care settings. And so this is to vaccinate both the staff and the residents that work or live in these areas. A lot of this vaccinating will be done by pharmacy partnerships with CVS and Walgreens. The health department will come in to help out in areas where those partnerships are not already in place. The third priority is to keep necessary healthcare infrastructure functioning. So this is healthcare workers who perform procedures, all outpatient healthcare workers. This includes physical therapists, mental health providers who see patients in the office, urgent care providers. A huge variety falls into this category, dialysis centers, and then also some who provide indirect patient care. So people who work in laboratories or pharmacies and hospital settings. Next slide, please. So moving on, so after phase 1A, we have phase 1B. And so you can see in the in the column on the left there, that in phase 1B, this is really to protect those people who are essential workers and those who are highest at risk for a severe illness if they were to get COVID. So just recently, an age category was added for those who are 75 and older. And then under that, you can see that it's a large list of people who are essential workers. So it includes K through 12 school and childcare staff. And then there's some definitions to the federal government of who is defined as critical infrastructure. This includes protective service staff. You can see this is a large category here. And then the next category is phase 1C. So this looks to vaccinate those who are people, again, who are at high risk of severe illness if they were to get infected with COVID-19. And so this is people who fit in the age category 65 to 74, or those who are 16 to 64, but they have some kind of underlying health issue that would make them more vulnerable. And you can see the list here of some of the illnesses that would qualify. And then phase 2. So this is when things get much more general and opened up to the larger public. So this is people who are 16 and older who don't otherwise fit into the earlier groups. Next slide, please. So this graph gives us a very rough timeline of vaccination. So on the bottom, you can see weeks. And then on the side, you can see doses per week in millions. So on a national level, this gives kind of a just visual for what it's going to look like. Just a couple key points is that there will likely be some overlap between phases. As we move from phase 1A to phase 1B, there still may be some people in phase 1A who need vaccinating while we start up on phase 1B. And the same thing as we go forward. We'll try our best to coordinate regionally so that we move from phase to phase somewhat together, but we know that there are going to be differences. There will be differences in how each institution deals with this. There will be differences in county to county, from state to state. And so I know it'll cause some frustration. I think we recognize how eager a lot of people are to get the vaccine, but we hope that there's also some patience in recognizing that there's going to be difference no matter how hard we try to keep things as similar as possible. And then with that, I'm going to hand it over to Christopher Bendecki, who is the Division Director for Clinical Services, to give you some more detail about vaccination.
Good afternoon. I just thought I'd share with you a few slides of what kind of goes into the planning and preparation for a mass vaccination clinic. As Carla mentioned, planning for mass vaccination is not new for us here at the Health Department. It's something that we have been doing for several years now with our emergency preparedness program. But obviously, we never thought we would be doing it at this level or at this scale. And when you layer in a pandemic, there certainly requires a little bit more significant planning and considerations that you have to take into account for. So when preparing for mass vaccination clinics, I mean, the obvious ones are the staff, the process, the flow in which the individuals coming in for the vaccination will enter into the building and exit the building. You want to take into account the site itself. So that's pretty much the biggest consideration at this point that we have to look at, particularly with the pandemic. You want to find a site that is accessible to, I guess, the main arteries of the county. If you're planning for one site, you want to look for a site that's accessible to the main thoroughfares, the highways, 131 or 96, accessible not too far north or south, kind of centrally located, a place with ample parking. You want to find a place that has preferably single story, limited entrance and exits, if you will. So you want to have try to not have as many touch points as possible in the building. So keep the number of doors, for example, the number of doors coming into the building as few as possible. For someone walking in to be vaccinated, they're not having to open 4 sets of doors. So you're limiting the touch points for cleaning purposes, disinfecting purposes. And obviously there is things you have to consider as far as the social distancing, which is the biggest issue, making sure that the space that you're looking at is large enough where if you had several hundred people standing in line, that they could be adequately distanced from one another, but also try to plan it in a manner that you can get people through in a very timely manner. So looking at possibly anywhere between 7 to 10 minutes from point of entry to point of exit. So it's a very fast process, but there's a lot of moving pieces to it. And then, as I believe all of them have mentioned, we have received our vaccine. We received it last week, and we've begun our vaccine clinics today, and as well as the beginning of end of last week, we started some as well. So you can go on to the next slide, please. So this was just a prompt for me to share our vaccination efforts. So as Nirali mentioned, that we have begun vaccinating our EMS staff, as well as health department staff who will and may be called upon to work at our vaccination sites. Next slide, please. And we recently acquired these mobile health units that we will be using to get out into the community as the phases open up a little bit more, to reach more of the vulnerable populations and vulnerable groups that may not be able to come into a site per se. So we would send a team of nurses or some staff out in this unit and we could either vaccinate inside of this unit or use it to go into the facility and vaccinate as well. Next slide, please. That's all I have. If there's any questions, please feel free to ask. I'll turn it over to Dr. Bora.
All right, thank you, Christopher. So we're going to go through some frequently asked questions, and there'll be time for questions afterwards as well. So this slide talks about, so what are the ingredients that are in the COVID-19 vaccine, the one that's made from Pfizer? So this one actually has very little in it. So this vaccine includes mRNA. So this is a synthetic recipe for the spiky part of the coronavirus, the part that sticks out on the outside. So you have this recipe. The recipe is surrounded by lipids. These lipids are pieces of fat that go around that recipe. And so that's what allows it to get into the cell once the vaccine is delivered. Also in this vaccine are salts. It has 4 different kinds of salts. One of them is a table salt that you use regularly. Another one is sugar. And that's really all that there is in this Pfizer vaccine. There are next slide, please. And what is not in the vaccine? So the things that are not in the vaccine are fetal material. There is no DNA. There are no antibiotics or blood products. Importantly, there are also no preservatives. I know this is a concern that many people have with vaccines, but this one does not have a preservative. It doesn't have gluten. It doesn't have any egg protein, and it's not manufactured using eggs like some of the flu vaccines are. There are no pork products. There are definitely no microchips that fit inside this. Next slide, please. So how many shots will I need? So I think, as Mary has mentioned, currently the Pfizer and Moderna vaccines are the 2 that are out currently. They both require 2 shots. One of them is 21 days apart and one is 28 days apart. One of the vaccines that's currently being studied but is not yet available does have only 1 shot. But as of now, anyone who gets a vaccine will need 2. Do I need to wear a mask when I get the vaccine? And yes, we do ask everyone who comes into any healthcare setting to wear a mask when they come to become vaccinated. So thinking about side effects. So the COVID-19 vaccine, as I mentioned earlier, has a little lipid, so that bit of fat that surrounds that recipe that makes that protein, that is something that your body can react to. And so afterwards, your arm may be sore or red or warm to the touch. Generally, they're finding that this goes away between 1 and 3 days. Some people may get a headache or a fever as well. So these side effects are signs that your immune system is working well and that this is working. The side effects that you will not get is you will not get side effects that are typical of COVID-19. So things like cough, shortness of breath, loss of taste or smell, those things, if anyone develops that, then you should get a COVID test. Because this vaccine does not have any live virus in it, it should not give symptoms of COVID-19. Next slide, please. So if I had COVID and recovered, do I still need the vaccine? At this point, the answer is yes. So the Advisory Committee on Immunization Practices provides recommendations about vaccination in general. And at this point, they are saying that yes, if you have had COVID-19 and you've recovered from your acute illness and you're no longer in isolation, then yes, there would be a benefit, they think, in getting the vaccine. But because you do get some natural immunity, which probably lasts about 90 days, if you want to wait closer to the end of that 90 days to get immunized, then that would be fine as well. So why should I get the vaccine if I can do other things to stay healthy? So as we know, yes, there are many things that you can do to prevent yourself from getting COVID-19, but it is hard. It's hard to always keep that distance. And we all, I think, do want our lives to get back to normal at some point. So using all these tools, vaccination is one of the many tools that we have. Until everybody is vaccinated or a large majority of the population is vaccinated, using things like hand washing and social distancing and wearing a mask consistently is still going to be helpful. And so this is another really good question. It's like, do I need to wear a mask and social distance if I have received 2 doses of the vaccine? So the vaccine, the Moderna and Pfizer vaccines that are out are very effective. They're 95% effective in preventing in preventing COVID-19, which is much better than many vaccines we have and much better than the flu shot, for example. But yes, at this point, the studies that are being done, we know that it prevents severe illness. So if I get a vaccine, I know that I'm much less likely to get severe illness from COVID-19. What I don't know is how well will the vaccine prevent me from spreading it to others if I don't have any symptoms. And so until we get more information to show that's going to protect other people around me, yes, we're recommending that anybody who gets vaccinated still continue to wear a mask. And so, as we're learning more, does immunity from COVID-19 disease last longer than immunity from the vaccine? At this point, we still don't know. We're still learning how long the immunity lasts. We think if you get COVID-19, that the immunity afterwards lasts about 90 days. In terms of vaccine, we just don't know quite yet. I've heard 6 months, but we don't have great data at this point to know exactly how long it's going to last. So who should not get the vaccine? In reviewing the CDC guidelines yesterday, it says that anyone who has a severe allergic reaction to any component of the vaccine, so the ones that I mentioned a bit earlier, should not receive the COVID-19 vaccine. And by severe allergic reaction, we mean anaphylaxis, usually. So sick enough that you need some kind of a shot or have to be in the hospital. Anyone who's had a severe allergic reaction like anaphylaxis to any injected medication or vaccine in the past should take precautions. This could be worrisome. I would recommend talking to your doctor if you have had severe reaction to a vaccine in the past before you get the COVID-19 vaccine. So what if I'm pregnant or if I'm breastfeeding? So, these are really good questions and things that we're still learning about. Right now, in the vaccine trials that have been done, pregnant women have not been included. So we just don't have a lot of data. But from looking at how the vaccine works, it's unlikely that it is going to be a risk to either the person who is pregnant or to the fetus. There are studies that are being planned, so I expect there to be more information coming out soon. At this point, if a pregnant person is part of a group that is recommended to receive the vaccine, they may choose to be vaccinated. There are healthcare providers who are pregnant currently who are choosing to become vaccinated. And same thing with breastfeeding. We don't have enough information to know about the details. And again, just like someone who's pregnant, someone who is breastfeeding may receive the COVID-19 vaccine, and there are healthcare providers who are breastfeeding who are choosing to get the vaccine. And as we learn more information, I'm sure we'll be able to share that. So what if I have an autoimmune disease or am immunocompromised? So people who have an autoimmune condition, they can receive the COVID-19 vaccine. Again, we don't have enough data on how safe or efficacious they are, but when they looked at the people who have an autoimmune disorder and looked to see the symptoms that they get between those who were in the trial and those who got the placebo, they found that there was no difference. So, we're not seeing that there is a concern, but again, more data needs to be found. So people who are immunocompromised, we know that they might be at risk for severe illness from COVID-19. They can also receive the vaccine. What we don't know is that there's a chance that they may not mount as much of an immune response, and so the vaccine may not be as effective in people who are immunocompromised. So there's still more data coming for them. There's no harm in getting the vaccine that we're aware of, but they need to be extra cautious about protecting themselves against COVID-19 through masks and distancing, even after they receive the vaccine. And with that, I think, I don't know if Lori, if you have anything more, but we'd be open to questions.
Perfect. Thank you very much, Dr. Bora and the rest of the health department team. We do have several questions that we received both through the email that was sent out with the calendar invitation for this event, as well as in the Q&A. So we'll just start firing questions away. The first is, I don't know if this is for Mary or Dr. Bora. You talked a little bit about allergic reactions. Can you maybe expand upon who should be not getting the test if they have allergies, as well as what happens in the testing when they give the vaccine and you have to wait 15 minutes and somebody has an allergic reaction? What is our protocol during that time period?
So the only people who should not get the vaccine at this point are those who have a reaction to any component of the vaccine. If someone has had a severe reaction to another vaccine, we would recommend that they talk to their doctor before getting the COVID-19 vaccine. Someone who has had anaphylaxis or a severe allergic reaction to a food or an antibiotic or something else, they could still get this vaccine. In our vaccination sites, and I'm sure all others as well, we do keep an EpiPen and Benadryl. And so we have a nurse monitoring for people for 15 to 30 minutes after they get the vaccine. If someone has signs of becoming ill, they will get an EpiPen, they will get Benadryl, and we will call 911 if we are concerned. If someone has had a severe allergic reaction, they will need to be monitored. In the past, they'll need to be monitored for 30 minutes after they get the vaccine.
Thank you. Carla, Dr. Black, this question is for you. I know you talked about this in your portion of the presentation, but can you walk through a little bit about the tiered approach as to who will get the vaccine? And if you are a Kent County employee who has been deemed an essential worker, can you expand upon what phase they would qualify to get the vaccine?
Question. So Dr. Bora went over this a little bit in the presentation, and just to be very honest, that we expect that there will potentially be some changes in those phases and shuffling around of people. So it's kind of hard to determine specifically where everyone is going to fall depending on their specific job. So just kind of overall, I'm going to say that there's the potential of staff falling into phase 1B, which would include essential workers who keep critical infrastructure open and functioning. What we don't have a lot of information on quite yet, and we're hoping to get some more clarification from the CDC and the state, is exactly what they mean by critical infrastructure. I mean, they're talking about government facilities, emergency services, financial, food and agricultural, healthcare, public health, nuclear reactors, materials of waste and wastewater systems. So it covers quite a bit, and so we're hoping we do get more guidance on what specifically that all entails, because it is quite a large population. So we're feeling that quite a few people could be falling into phase 1B, but it will really depend on the department, what their specific function is, and even down to the employee's specific functions. So unfortunately, I can't give a much better answer than that right now.
Can you tell us where law enforcement falls into the tiers of distribution?
So law enforcement is also in 1B currently.
Thank you. Just looking here at some of the questions, and I don't know who this may be for, if this is for Dr. London or Dr. Bora. Can you talk a little bit about the new strain that they are finding in the UK and what impact that may or may not have on the Pfizer, the Moderna vaccine that we're receiving?
I can briefly touch on that. It's not a surprise they're finding new strains. RNA viruses do mutate quite frequently. It's not going to be the sort of mutation that's going to make the vaccine ineffective. We expect the vaccine to work as effectively as it has against the other strains, which it's been tested along with in that clinical trial. I think that as these things change, we're going to see a little bit of change maybe in the communicability factor. It may be that this particular strain in the UK is a little more contagious, but it doesn't appear as though there's any information that says that it's going to have more severe health consequences, or that the vaccine won't work against it. So it is still substantially the same virus that we've been talking about all year long.
And this may be a question for Dr. Bora or Mary. If you receive the first Pfizer or Moderna vaccine, but due to extending circumstances, you cannot get the second shot, what is the protocol at that point?
This is Mary. Again, we have limited information, but much like our other vaccines, you do not start over. So even though it's not ideal, we would just give you that second dose of vaccine. As mentioned earlier, if your first dose is Pfizer, the second dose should be Pfizer. Same thing with the Moderna vaccine. But they're making all kinds of little things available to us so that if there is a problem, like I don't want to give you one dose Pfizer and one dose Moderna, but if it does happen, the dose will count. And so you never will have to start over.
Thank you, Mary. Either Dr. London or Dr. Bora, can you talk a little bit about the clinical trials that are currently going on right now as it relates to children, and when we think that these vaccines will be available to those that are under 16 years of age?
Dr. Bora, do you want to handle that one?
Sure. I'm not completely up to date on which age groups are being studied right now. My understanding is that there are children for the age of 12 to 16 that are in these trials right now. But I think that's going to come out later. I would hope later in the year we will see vaccines that are available for children.
Yeah, I think that recommendation for vaccine to children is going to be very important. As soon as we have good information to support that recommendation, because for us to get to herd immunity, where 2/3 at least of the population are vaccinated, we really need to find a level of comfort and assurance with the data that we can make that recommendation for children as soon as possible.
And Dr. Bora, you did touch on this in the frequently asked questions, but we're getting several questions about pregnancy as it relates to the two vaccines. Are the vaccines safe for someone who is planning on getting pregnant in the near future?
So at this point, the American College of OBGYN does say that it is safe to get the vaccine for those who are planning on getting pregnant in the future. As we know, there's still just not a ton of information about long-term consequences, but from the way the vaccine works, and we know that there's slightly higher risk of severe illness for those who are pregnant, and we know that having COVID-19 can affect fertility in and of itself, that whatever we can do to prevent it, we think will be helpful. So at this point, yes, it is recommended.
And Dr. Bora, this is a question for you as well. If you have tested positive for COVID-19, when can you receive the vaccine? Do you have to wait 3 months, or can you get it immediately if you fall into one of those approved tiers?
You don't have to wait 3 months. You do need to wait until your symptoms have improved and that you're no longer in isolation. Once that time frame is done, you can get the vaccine. If you wanted to wait closer to the 90 days, you're welcome to do so, but you don't have to.
Okay, thank you. Mary or Dr. Bora, I know you guys hit on this, but can you tell us what are the major differences, maybe 1 or 2 key points between the Moderna and Pfizer vaccines?
I mean, from my perspective, the main difference is the storage and and that you don't need the ultra cold freezer for the Moderna. But they're the mRNA vaccines. They don't have live virus. They work in a very similar way. Mary may have more to add.
Thank you, Dr. Bora. This is Mary. And again, as Dr. Bora said, these are both messenger RNA vaccines. There's no big difference. The one thing I would like to add, though, is that the Pfizer vaccine was approved for age 16 years and up, while the Moderna vaccine that just came out was approved for age 18 years and up. So again, another slight difference, but both vaccines, they're not live. They cannot give you disease, and they work much the same way.
Thank you. And this question, I believe our Human Resources Director, Amy Rolston, is on the line. Amy, this is a question for you or one of your team. If you are a Kent County employee, will we be required or mandated to receive the vaccine?
No, at this point, there aren't any plans or conversations about mandating the vaccine. We would strongly encourage it, however.
And Dr. Bora, you had talked a little bit, I think, during the your part of the presentation, that if you do get side effects as it relates to the vaccine, that it is your immune system working properly. But what if you do not get any side effects or you feel great after you get the vaccine? Does that mean that your immune system is not working?
That's a good question. After I said that, I had that thought. No, that does not mean that. Different people react to vaccines in different ways, and that is totally normal. Some people will have more severe reactions, but it doesn't mean that if you don't have those reactions that it's not working. So no, sorry about that earlier.
In fact, Ronnie, if I could add, the majority of people won't have any side effects at all. Isn't that correct?
I think most people won't have any kind of severe side effects, no. Some people, I think it's pretty common to get like an achy arm. That's fairly common is what I'm reading, but yeah, anything. Yeah, go ahead.
Go ahead, Dr. Bora. This is Mary, and I got my vaccine last Friday. I didn't feel like I even had a vaccine, but that night I bumped into a door and my arm hurt. And when I stretched it out, my arm hurt as well. Saturday morning, my arm was a little sore, and by the end of the day, I had nothing else. I talked to another gal who got immunized. She had a very sore arm, much more so than me. However, that was also gone in 48 hours. So as Dr. Bora said, everyone reacts a little differently, but your body's pretty smart in the immune system. And so even if you don't have signs and symptoms, it is working.
Thank you. And Dr. London, Dr. Bora, or Mary, can you just reiterate how long a person is protected if they get vaccinated? Will they have to get this every year like the flu shot, or is this a one-time deal?
So that's a great question, and one that researchers around the world are looking at right now and are going to look at for the near future. Because we don't have a longitudinal study right now that has really measured that. So we know the vaccine is effective at preventing illness. We don't know for how long. It may be for a very long period of time. It may mean that you need a booster or a repeat of this with some frequency. Researchers are going to be studying that over time to see what level of prolonged immune response remains. And based on those findings, they'll make recommendations at some point in the future to all of us about repeat vaccinations if they're needed.
And Dr. Black or Dr. Bora, can you talk, going back to kind of the tiered approach as to who is going to receive the vaccine, do you have any information as to where our correctional facility, both the workers and the inmates, will fall into that tiered approach?
So this is Dr. Black, and based on the MDHHS guidance currently, that would be in phase 1B. That includes the essential workers to keep critical infrastructure opening and functioning, which does include corrections facilities, prisons, jails, and juvenile justice facilities.
And maybe Mary or Dr. Bora, are we currently only vaccinating with the Pfizer vaccine, or will we be receiving also the Moderna vaccine?
So this is Mary. We currently have gotten our first and only order, and that was the Pfizer vaccine. I believe the Moderna vaccine, the first order will probably go to local health departments and hospitals that do not have the ultra cold freezers for storage. But I believe in January, as doses open up, we will be getting both vaccines, because Kent County Health Department Fuller is also a redistribution hub. So other providers that are approved, we will be able to give them vaccine from our allocation as well. And then I imagine as more and more vaccines are approved, we will have several different types available.
And I don't know who this is for, so I'll open this up to anybody from the health department. If I live in Macomb County but work as for Kent County, where do I receive the vaccine? Can I go to Kent County, or do I have to be a resident of that county to receive the vaccine?
They will be able to receive the vaccine here. I would imagine that their own home health department will be providing a link for registration as well. So it would really be whatever is most convenient for them. We're not going to cross-check home address as part of our requirements. We really, when I say we, I mean everyone in public and in medical health across the state, just want people to have the opportunity when their phase comes along to get vaccinated as quickly as possible.
And when or how will individuals know what tier they fall into and when they can get vaccinated?
So that's a great question, and that's where we really encourage everyone to go to vaccinatewestmi.com. That's the website that we, us and all those partners that we showed in that slide early on, are using to share that information about where we stand in the phases at any point in time. We'll also be providing links for registration once that becomes available. Right now, we're vaccinating people by invitation. You know, we're really looking at that phase 1A1 group with EMS and those first responders, medical first responders, and we're inviting them to come in. As this becomes more open to a wider group of the population, we'll be broadcasting through all of our media where and when people can get vaccinated. We'll also be working with HR to make sure that the departments and our staff know when opportunities for vaccination are available to county staff. We've got a little bit of work yet to do to identify where some departments may fall in this structure, in those phases. Certainly some of the work that we as a county do is essential workforce activity. And so we'll be working with HR and your departments to make sure that you get that information as quickly as possible.
Thank you, Dr. London. And recognizing the time, we will stop there. We have received several inquiries as to whether this presentation will be available. It was recorded, and that we will send out the link yet today, as well as this PowerPoint presentation to all county employees. So with that, I will turn it over to Wayman for some final comments, and then to Darius Quinn to finish out. Wayman?
Thank you, Lori. Outstanding job, health department team. Lori, thank you so much for putting this together. This is awesome. We want to continue to provide information that's relevant, that's helpful to all of our employees. And I hope this was informative for everyone. I just want to thank again, Adam. Your team is awesome. Continue to do the work that you're doing. We really appreciate all the hard work from everybody. And Please stay safe, everyone. Darius, you're going to come on, and I'm just going to say thanks for all of the hard work, everybody. We've made it through some really tough times, and please be vigilant, remain safe. Thank you.
Thank you, Wayman. And just to echo Wayman, thanks to everyone for all of your work in helping to keep our workforce and our community safe. You should also be on the lookout in your inbox, your email inbox, either today or tomorrow for additional information from Human Resources regarding the paid sick leave that will be available in 2021. So again, thank you and have a great day.
Thank you, everyone. Happy holidays.